Food and Drug Administration being one and the Drug Enforcement Administration being another, have the responsibility to make sure that drugs that are delivered to the pharmacies of this country are in fact not only legitimate, been produced legitimately, but are effective and safe. 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 Effective and safe.
It's becoming more and more evident that any substance capable of inducing a psychoactive effect, whether it be over-the-counter, controlled or non-controlled, may be misused and abused for non-medical purposes.
Is crack worse for a person than marijuana?
I believe all illegal drugs are bad.
Is methamphetamine worse for somebody's health than marijuana?
I don't think any illegal drug
is
good.
Heroin worse for someone's health than marijuana?
Again, all
I mean, either yes, no, or
drugs.
I don't know. I mean, if you don't know, you can look this up. You should know this as the Chief Administrator for the Drug Enforcement Agency. I'm asking you a very straightforward question. Is heroin worse for someone's health than marijuana?
All illegal drugs are bad.
Does this mean you don't know?
Heroin causes an addiction.
Okay.
It causes many problems. It's very hard to kick.
So does that mean that the health impact of heroin is worse than marijuana? Is that what you're telling me?
I think you're asking a subjective question.
No, it's objective. Just looking at the science, this is your area of expertise. I'm a layperson, but I've read some of the studies. I'm aware of it. I'm just asking you as an expert in the subject area. Your agency has established abuse of prescription drugs as the top priority. Is that therefore an indication that prescription drugs are more addictive than marijuana?
All illegal drugs are in Schedule 1 are addictive.
Well, drugs is a word which has polluted the well of language. Part of the reason we have a drug problem is because we don't have an intelligent language to talk about substances, plants, sedative states of mind, states of amphetamine excitation. We can't make sense of the problem and the opportunities offered by substances unless we clean up our language. Drugs is a word that's been used by governments to make it impossible to think creatively about the problem of substances and abuse and availability and so forth and so on.
In the minds of the people, the word drugs, which was once used as healing medications.
There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things. Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%. They don't wear out, they go on working, they do not have serious medical side effects. And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Drugs mean that which cures us and the greatest social problem of the generation. So there, right there, you see the schizophrenia involved in thinking about drugs. Apparently there are good drugs sanctioned by science and medicine and bad drugs used by brown people in strange rites and growing in unusual plants in distant parts of the world. This kind of thinking, because it's naive, leads, of course, to social problems and bad politics and bad social policy.
I'll write you a prescription for Quaalude, but you must be very careful.
And I think you should know that people speak very highly of you, and now I see why.
The problems in the war on drugs and in our whole attitude towards drugs is that since approximately 1914, the Harrison Narcotic Act is a kind of a watershed mark. But since approximately that time, there has been a steadily increasing medical monopolization of drugs, so that medicine, the medical profession and the government are in alliance in a paternalistic way telling people what they can take and what they can't take.
There's very little education, formal education in medical schools, in nursing, in pharmacies, as it relates to the screening, evaluation, and proper treatment of patients with chronic pain. Are there not already many education material out there? Yes, there is significant educational material out there, but many of them have been funded through subsidy from pharmaceutical companies. And I think that one of the concerns has been to what extent there may be some conflict, whether that in turn affects the quality of the material.
An interesting question is, if people are prescribed cannabis, does that have then an opioid-sparing effect? Because, again, for chronic pain, we do use opioids, Vicodin and drugs like this.
So you mean, could it replace?
So could it replace or lessen the requirement? We need studies to understand that, but I think the preliminary evidence suggests that may be true.
UGA researchers looked at 17 states that had legalized medical marijuana as of 2013 and 9 different medical conditions. The conclusion, marijuana use saved Medicare more than $160 million in 2013 and could have saved almost triple that had it been legal in all states.
When marijuana becomes a medical option for people, then their use of prescription drugs falls.
David Bradford is one of the authors of the study.
We think that the only plausible mechanism is that people are shifting, at least in part, towards using marijuana as medicine.
Current treatments, primarily medications and psychotherapy, are effective, but only for some people, some of the time, and often only partially. Most frustrating to me is that we haven't seen any significant progress in the treatment of these conditions in the past 4 decades.
Put people to sleep and they will relieve anxiety. As soon as we start to ask the question over 2, 3, 4 months or 2, 3, 4 years, what's the effect? I don't think we know the answer to this, and that's largely because it hasn't been looked for very carefully.
Drug corruption of the central institutions of society on a massive scale.
But that has gone on till our days. We have alcohol, we have tobacco.
Well, this is my very point, that every society chooses a small number of substances, no matter how toxic, and enshrines them in its cultural values, then demonizes all other substances, and uses and then persecutes and launches witch hunts against those users whenever some political pretext requires witch hunts and persecutions. So it's an old game, and it's been played in many places. From the time I was very young, I was fascinated with the idea of extremely dramatic changes in consciousness from which one recovers after a few hours, induced by plants. And I discovered through the writing of Aldous Huxley and other people that this was a worldwide religious and cultural phenomenon that my own Catholic middle-class upbringing had completely overlooked and denied, and I've been fascinated with it ever since. You know, it's a bit like sexuality. It's something which the Calvinist intellect would just prefer didn't exist, but in fact, the phenomenon of being human beings in animal bodies with a relationship to nature makes it important for us to address these altered states of consciousness and the plants, the substances, and the cultural institutions that come into being around these things. To my mind, human history is the story of one substance after another distorting or transforming human values and society.
But do we need, say, more research, or do we know all we need to know about entheogens or hallucinogens
No, we need endless amounts of research. The fact that these things have been illegal in most countries for 50 years means there is a huge lag in understanding the impact of these things on human beings.